So welcome everybody. Today we have gathered together to talk about women diseases. We have a guest today who is Professor Seth from Stanford University. He has a chair in medical faculty actually, and he has thousands of studies and of works on ovarian functions, and including early menopause, polycystic ovary syndrome, and for sure endometriosis. And also we know him by the drug, actually, the medication that he has found from his laboratories, the gonadotropin hormones that we use in IVF cycles today. So he's very popular with it also. And also the IVA, the medication, again, the therapy that we apply to the patients for early menopause, came throughout the corridors of his laboratories, actually. And I am from his laboratories too, also. I had a seat. I had the chance to have a seat in his laboratories for a while. So thank you very much for being with us today. And I also want to introduce Ezgi to you and to everybody. Ezgi is a PhD, actually, and also an MD. She is working as a genetician, but besides, she has also a PhD which is going on history, archaeology. So she's a really interesting woman. And also leads the subdivision of our society, Endometriosis Research and Association, Research and Support Society. And she has a subdivision called Hypatia, right? And she is doing archaeological, genetic archaeological women studies on that subdivision. So about our talk, about our speech today, I believe she has thousands of things on her hands to add or to ask. So the scene is yours, Professor Seth.
So should I start with some introduction background of the story?
Sure.
You can hear me now, right? You can hear me?
We can clearly hear you.
Okay. So what I have done is I'm certainly working, well, first, thank Baha for inviting me. It's a very nice opportunity because last month I was in Turkey and traveled different places like Cappadocia and all those places. So it's a very interesting country and I enjoy it. I'm working on as an ovary physiologist, as Baha already mentioned. And the other aspect of my work has been on the evolution. And I have a book that's coming out pretty soon about the evolutionary medicine. That is, how does the evolution affect the medicine? And I have an article which Baha can share with some of you about the female out-of-step adaptation. That is, our ancestors living in a certain environment, and all our genes adapt to that environment so that we can survive. But on the other hand, our environment changed so much during the human society, and including our environment and our social condition, which I will discuss very soon, which makes a lot of different disease begin to show up, including endometriosis, which is the thing we're going to talk about today. So I want to share my screen. Host disabled participant. I don't know what that means. You have to open the share screen for me.
Sorry.
Okay. Can I do it now? Yeah, okay, great. Okay, share. Okay, so what I'm prepared is a few slides, and we can discuss more after I sort of did the introduction. So I understand this is a society working on endometriosis. So the simplest way to understand endometriosis is your monthly menstrual cycle, all the blood and some of the tissue has to come out from the vagina. But on the other hand, as some of you know, that the top part, this is the oviduct, and that's where the ovary give the eggs coming in. So there are 3 openings: this side, and this side. And if something goes wrong, your blood, in addition to coming out from here, also begin to backflow into the system. Then these are the endometriosis in different places, all this structure surrounding, and they will stay there because they have no place to go. And every month when you have menses, this tissue are just like the uterine tissue are responding to ovary hormones, and then that begin to cause problems. So that's the simplest explanation for this. So we have to, for sure, have to deal with menstruation when we talk about endometriosis, because that's the result of frequent menstruation. So menstruation is a big problem for the modern society, and it's a taboo, actually. Menstrual taboo. In some society, menstruation is being perceived as unclean. In Hinduism, women cannot enter temple, work in kitchen, wear flowers, and all this. In Japan, they are not allowed to enter Shinto. So these are different countries, all have this problem. On the other hand, even have the extreme cases because menstruation affects their work schedule. There are uterus villages. People just take out all the uterus so that they can continue to work without being disrupted every month. On the other hand, there are also societies that begin to realize this problem, and Scotland, the government will provide menses accessory for women, so that it's all free. The government will provide for free. So we are facing with a very interesting dilemma, which is only coming in evolutional very recently. That is, in addition saying all this taboo and all these different things, you also have the other mystery. It's a myth. That is, women feel that if they don't have menses, they are not women. The womanhood, the femaleness, is somehow related to monthly blood loss, which is as you understand, when I discuss this issue, then you understand, has nothing to do, the blood loss has nothing to do whether you are female or not. Okay. So why do we, but not many other mammals, evolve menses with menstrual blood loss? This is only found in the primates. It's not found in the rat, rodents, for example, it's not there. The reason is, during our menstrual cycle, menstruation occurs as a consequence of hormone-induced differentiation. That is, the ovary hormone, estrogen, progesterone, then give you a lot of these blood vessels. Okay, endometrium with spiral artery allow immediate implantation of limited number of early embryos. This is so different from many other species. They have a lot of embryos ovulated every month or every depends on the reproductive cycle. But female, we have only one. In human female, we have only one, and even other primate also very, very few. So this over millions of years, we evolve a system that is the estrogen followed by progesterone stimulation give you a lot of this very rich endometrium ready for implantation. So we call it secretory phase. This is a lot of endometrium glands, spiral arteries, and also scientific terms called decidualization. But so during this period, a lot of the endometrium tissue are ready for immediate implantation. In the rodents, they have to use the embryo to induce all this structure in order to have implantation. So, but if this implantation doesn't take place, the blood has to go somewhere. All this vessel has to go somewhere. And then also eventually some of them lead to endometriosis. Okay? So I want to make one very important point. This is the evolution point. Menses only occurs in primates, as I mentioned already. It's a rare event in our ancestors. If you look at 3 generations ago of our ancestor, they have 10, 15 children. They are pregnant immediately after they reach puberty. They never have the chance to have menses. So menses is the modern event. When the whole society changes, then we begin to have, we have to have marriage system. If you don't get married, you don't get pregnant. Okay, so our ancestor, and this is in evolution term, it's a very short term. Okay, in terms of 3 or 4 generations ago, they have 10 children, they have 20 children, some, because they are continuously pregnant. They don't have the very solid marriage system as we do. But this social changes is a out-of-step adaptation. Our original adaptation was to make sure we always succeed. We have only one embryo, and that embryo is already, the uterus is already ready for the embryo to implant, and we'll have children. We have the next generation. But now suddenly we have all this society changes to allow us many, many more menstruation. So I asked the question, you can ask the question, do menstruation represent femaleness? No, it has nothing to do with femaleness. The reason is, if you look at female, okay, we have pituitary, which secrete LH, FSH, which works on the ovary, and the ovary, as we already discussed, will have ovulated, and then they go through this oviduct, fallopian tube, going into the uterus. Okay, and ovary also produce steroid hormone, estrogen and progesterone, which stimulate the uterus to give us this spiral or artery, give us all this special endometrium. So we can easily change the uterine environment, and as I will mention to you later, and then at the same time, without affecting the ovary function at all. Ovary is our femaleness, okay? Like testes is for the male, okay? But uterus is a side effect because our body makes sure we produce enough estrogen progesterone to make the endometrium ready for implantation. So these are the hormone changes. The pituitary comes in, LH, FSH, and then every month you have, this is the whole cycle of 28 days, and around 14 days you have LH and FSH increases, and the ovulation in the ovary will take place. Okay, and at the same time, uterus begin to change, and then this increases, changes the estrogen and progesterone, which give you this change. So you can take away the bottom half. The rest half can still function perfectly if you do it right. So then comes to the real thing, which everybody used, and I was involved in the early days when they designed the contraceptive pills. So the companies say, we can give them estrogen and progesterone to suppress high dose, to suppress this estrogen, to suppress the LH and FSH. So we don't have the surge. Then we will not get the ovulation. However, then we give them progesterone. However, they discuss this, the company discusses, they say the females will not take the pills if they don't have menstrual blood loss, because this is the myth. Because everybody thinks if you have monthly blood loss is a good thing, okay, make you female. But if you understand the science, there's nothing to do with that, because this is the bottom half. You can maintain this half. So what happened was the company in the old days, they give you a 28-day pill, and then the first few days is give you estrogen increases, and then they give you estrogen plus progesterone. then they on purposely give you blank pills without anything, so that it's like this withdrawal, like this coming down. Then you have blood loss. Okay, so even contraceptive pills, they do artificial menstrual flow to make the general public accept using using the pill.
Yeah.
So this is a misunderstanding, and people don't understand this. Most people don't understand the science, and companies are not willing to spend all the time, all the money to advertise, to educate the people, women. They're not, no, it's just too much money for them to do that. So they just say, we do it a simple way. We just withdraw. We don't give them blank, and then they will have blood, okay? So the question is, can we have days without monthly bleeding, right? So yes, you can. We can use intrauterine device. Just put the device into the uterus only, containing progesterone. So we don't have this progesterone withdrawal. Then we can skip uterine bleeding without affecting ovarian function. So, I mean, if most people don't want to go through this trouble, but if you continue, if you are taking exam and your blood is coming, you know it's going to come these days, you can take progesterone. Just make sure it will delay the bleeding. So there are very simple ways to do this. On the other hand, I also see doctors who have, this is a college student coming in because the exam or the stress. The doctor comes to the doctor say, I don't have menstrual cycle now. My menstrual cycle is irregular and very little bleeding. There's something wrong with me. And then the doctor will give estrogen and give progesterone plus estrogen, and then withdraw and then show the blood. This is totally crazy, because the college student probably, just because the stress at the pituitary level, the brain, the pituitary is not functioning optimally. And that's fine. After the exam, everything is fine, will be okay. But you don't give artificial menstrual flow to sort of cure the patient. That's a total joke. Anyway, so I want to just add a little bit story behind this. In addition to this, actually, women's reproductive cancers and endometriosis, as we just discussed, can be looked through an evolutionary context. Why is there an increase in endometriosis, which you guys are interested in? Actually, at the same time, we have increase in breast cancer and uterine cancer in the modern woman. In addition to nutritional practice, we have much better nutrition. We don't exercise as much like our ancestor, and the body composition, we are fatter, okay, which makes more estrogen. Reproductive experience for women in the modern society differ from the women in the hunter-gathering society, our ancestor. This difference contributes to a higher risk of endometriosis because we have more menstrual cycle. And together with cancer, we have more menstrual cycle, more estrogen, we have breast cancer, endometrial cancer, and we have more ovulation, which give you more chances of ovary cancer. And this is compared to our ancestor hunter-gatherer society. Some kind of society, menarche, they are 16 years of age. Now in the US, it's 12 years of age. So you have more cycles. When you have more cycle, you have more breast cancer, estrogen stimulation, you'll have more endometrium, okay? And age at first birth, I already mentioned. Our ancestors get pregnant right away. They don't have chances of delaying because of marriage or because of contraceptive pills. And age of menopause, slight change. The most important is this one. Our ancestor has averaged 160 cycles. We have 450 cycles, okay? So if you estimate the time you have menopause at 50 years of age, you start at 12, you can calculate 400 something. So we live longer, we have fewer infectious disease, we have estrogen excess because every month we are stimulating. We have incessant ovulation, we always ovulate every month, and all this give you more breast cancer and uterine cancer, endometriosis, and ovarian cancer. So I will stop here, and then you can ask discussion.
Thank you very much. Exactly. I want to mention that I can never forget the hypothesis that you taught us when we were studying about the different type of human types and in conjunction between the cultural evolution and the body evolution. So what are the causes of for the modern life? Actually, these are all true for the menstrual life too, as you mentioned. We can get that from it. And I just want to ask, I mean, as you mentioned that under stress, we lose some cycles, there's no bleeding coming out. So we are trying to give some estrogens or progesterone pills. So it is happening actually on PCOS patients, that they have less cycles. But the thing about them is they have too much estrogen. So it is again not good for us. So it is again the reason of some kind of cancers. So can we say that the protector of the evolution is kind of progesterone?
The what? I'm sorry. The last.
The protector of this evolutionary status is kind of, we can say, it is progesterone that we need with us, not the estrogen, maybe.
So you're trying to say PCOS is related to what?
On PCOS patients, we have less cycles, which should
less cycles, yes.
Yeah, according to the evolution hypothesis. But on that patients, yes, they have higher body mass indexes, something like that. But they have excess estrogen, and they have higher risk of cancers too. So can we say that I'm overprotector against including this kind of patients, including the cancers?
Yes.
Actually, including endometriosis, we can say it is progesterone that we need to be properly evaluated.
So you are saying is the progesterone is good? Or, yeah.
Is it?
Depends, because when, as I mentioned in the endometrium, when you have estrogen and progesterone together, then you have all this special endometrium ready for implantation. So it's good in the sense that if you continue the progesterone, then you will not have blood loss, right? And but on the other hand, it's difficult to evaluate the effect on long-term estrogen progesterone continuous stimulation on the breast. It may affect the breast function, so that's a different story. So whatever I'm talking about is all temporary changes. That is, if we understand the changes of progesterone withdrawal causing the blood loss, we can prevent that. And if we prevent that, we don't even affect the rest of the function, the ovary function and the pituitary function. Yeah, and but PCOS is more complicated. PCOS, we still don't know exactly how PCOS comes about, right? I mean, it's somehow related to obesity, which is a modern event. But whether that's the main cause, we don't know. Actually, we have been looking at whether the AMH is blocking the ovulation. That's another story, but that opened up a whole big discussion. So I would not, because that's not demonstrated. It's just because basically we don't know enough about PCOS. We know they are infertility issue, but whether what is the real reason, we still not clear.
So we could say that we need that waves of estrogen and progesterone, but what we don't need is the withdrawal of the progesterone. Yeah.
Yes. Well, we need that way, and that maintain our ovary a continual functioning, but we don't necessarily have to have blood loss because that's a separate level. We have 3 levels, right? The hypothalamus, pituitary, and ovary, and the uterus. So everybody, because uterus blood is the easiest thing to see. Then so everybody says, oh, I have blood loss, then I'm female. It has nothing to do with that. That's what I'm trying to say. Yeah. And I heard some female can actually detect which side ovulation. Some people can feel their monthly ovulation. So they have good way to tell they are female. They don't need to see the blood loss.
That's true. And Ezgi, I remember you had some questions.
Yes, and thank you for presentation. And I'm really excited to read your book about woman evolution. And I think it will be so fantastic. So I want to ask about something about frequency, about we know that each month we have, as women, once a month we have menstrual cycle and blooding. So do you think in the future these periods will be less common, like 3 in 3, or less cycle will occur or continue like this? What do you think?
On evolutionary basis. If we are to see like 1,000 years from today, is it something that we are going to face, right?
Oh, no, I mean, even today, we don't have to have, if you talk about menstruation as blood loss, that even today, we don't have to have it if we understand it. But we do want to have our ovary function properly, right? And now women live so long, in our ancestors lived to 50 years old. That's incredible. Now we live to 90 years old average. So the problem is again, this is an evolutionary new event, and all the female have their life need to face. They don't have ovary function because ovary function stop at 50 years of age. How are we going to live another 40 years without the estrogen, without the progesterone? And then that's really the femaleness, because if you don't have estrogen, your memory loss, you have osteoporosis, your skin is beginning to feel old. So there are a lot of things. So hormone replacement is a very important issue. Although in general, the doctors are not too worried about it, but if you really face this as a whole society, everybody live too long, especially female live longer than men. So you all need some kind of replacement therapy, because our ancestors never lived that long. They don't have to face the same problem.
So what do you think? I mean, rats or mice doesn't have menstruation, but they do get pregnant.
They induce it. Okay. Since you are asking this question, then I will share the screen again. This is a picture is in the article. Actually, if you check the article, you can share with your colleague.
We have it.
This picture. Yeah, this is a rodent. Okay, rodent has the same, LH changes and estradiol changes, progesterone changes, as I mentioned for the women, but the period is only 4 days long. So endometrium is not stimulated that much, and there's no menses. However, if the rodent have embryo comes in, embryo will induce this to grow even more, uterus to grow more, and they can get pregnant. So, but they have so many embryo, doesn't matter. Every time they ovulate, 12, 20 to 20, depends on the species, the sub strains. But women, we have only one. So we are already decidualized. We are ready. So if embryo comes right away, the blastocyst, so this month did not happen, then menses. But if this month the embryo comes, it's right away implantation, right away blastocyst, so you don't have blood. So our ancestors continue to get pregnant and they get lactation. When you have lactation, you also have no menstrual cycle. Because the hyperprolactin blocked the LH surge. So your ovary function is sort of dampened. Your ovary is not functional. You don't have this high estrogen, hyperprogesterone coming in. Because when you are pregnant, there's no need for the uterus to get ready. So lactation, pregnant and then lactation. Usually our ancestors lactate for several years. And now we only do it a few months. That's another problem. So again, more menstrual cycle, again, more estrogen, again, more ovary rupture, follicle rupture. So you have more chance of ovary cancer. And so it's an interesting story that all this are related to our basic understanding of what's going on.
So one more question. If we want to stop the bleeding, on the medication we have, I mean the hormonal pills, they just make the estrogen and progesterone on the same level. They just stop the the wavings of the levels of the estrogen and progesterone, so we can stop the bleeding or ovulation today with the medication that we have. So do you think in future we might have something that makes us feel like the rodents? I mean, we are going to have the wavings, but we don't have the bleeding out. So we can't even get pregnant while using that kind of things, and we also won't have the blood loss.
Yeah, that's what I was saying. That is, if you do an intrauterine device that containing progesterone, which is available, which is used as a contraception also in the US, then the lady can have 1 year without any menses. So that only release small amount at the uterine level. It does not affect the rest of the body. But that's people haven't done long-term study. But theoretically, that should not be affecting the ovary function entirely for a long time. So the other possibility is the emergency. You know that day you are going to take an exam. It's a very important exam. You just take progesterone, small amount, and then make sure those few days you will not have sudden menses and causing all kind of problems. So that's again, as a doctor, you have to make those decisions for your patient. But most doctors do not think this way, do not understand. I was so shocked. I was talking to an endometrium expert who sells all the money to do genome sequencing of the endometrium, and then trying to help the implantation. And I asked him, why do we have menstrual loss and menses? He doesn't understand, because most people don't think the way from an evolutionary viewpoint. That's the problem. Yeah.
I think that should be all. And I just want to thank you if Ezgi doesn't have any more questions. Okay.
And yes, I have one more question.
Yeah, sure.
Yes. Hi.
Yes. In the article you mentioned about the grandmother hypothesis, so I found it very interesting. So do you think this hypothesis occurred as a result of menopause or daily life needs, like bearing grandchildren, taking care of them? It's something like is egg from kitchen or chicken from egg, but what do you think about this? Do you want to say something?
You are saying about the menopause hypothesis. Why we have menopause?
Yeah.
Yes.
Right?
Yes.
Okay. Yeah. Menopause is a very difficult to demonstrate. There are people who say in the grandmother hypothesis, the grandmother take care of the younger generation, but our ancestors don't live that long, so I don't quite like the hypothesis. Our ancestors, I mean, they will become grandmother, but still, I mean, 50 years of age, they die already. So it's not a very for the menopause, I think the thing is, once from the evolutionary viewpoints, once you have your children, you are done. You don't have to live anymore because evolution just continues. Okay, so give you an example. If you give growth hormone, if you take away growth hormone in a rodent, they live longer. Growth hormone is very important for our survival and growth. But once you pass your menopause age, I'm sorry, once you pass your how should I say? Once you reach the reproductive age and have the children, there's no selection anymore. You don't have to continue to have it. So your growth hormone may cause problem for your aging. So at the later part of life, it end up causing problem for you because it causing you die young, causing you to die. So the best example is IGF-1. IGF-1, they use C. elegans, the very small organism. So this is throughout all the animal kingdom, okay, this phenomenon. So if you take away IGF-1, the nematode, the small worm, will live twice the age. Mm-hmm. So IGF-1 is good for you, so you grow up and you reproduce. But you know, at the end, the second part of your life is bad for you because it's causing you to age faster. So it's a very interesting dilemma for evolution. But evolution doesn't care. Evolution just want to have continue to have the species. That's the selection force. It does not select for anything else.
It is science. Yeah. Okay, thank you very much. I think it was really a gate-opening talking for us, and I believe our audience is going to love it because we are not always talking something like that, something about evolution too much. And I think it was really interesting. Thank you very much.
Yeah. Okay. Thank you.
Thank you.
Bye-bye.
Bye-bye.